Good afternoon, everybody, and welcome. Hopefully you're able to see and hear us. Just want to say hello from the E-QIP team here at the CMHA Ontario office and welcome you to our evening version of our webinars. And today we're going to do a primer on governance and leadership for quality improvement. Really taking a look at some of the key messages for boards and leaders around quality improvement. So just some housekeeping items before we get into the content around using GoToWebinar together. You'll see that you can make the little menu bar larger or smaller by clicking on the arrow in the top left. It's in orange. You can also call in and listen via phone or use the audio available on the GoToWebinar by making sure that it's enabled. We will be taking questions at the end of this session, and you can feel free to type your questions sort of as we go through the webinar into the question or discussion box, and we'll be monitoring that on our end and responding to it. We also let you know too that all the webinars that we deliver are recorded and posted on E-QIP's Community of Practice, as well as the reference material and handouts that we discuss so that you can access them and share them after the webinar is over. So if you could today, just let us know how many folks are with you in the room participating in this webinar, just so we can get an accurate number of participants. So if you wouldn't mind, take a minute and just type in how many folks are at your site joining the webinar today. I see people doing that already, so thank you. So the objectives for this session today, we're hoping that we can increase awareness of accountability expectations for boards related to quality improvement, to develop a shared understanding of the board and senior leadership role in establishing the link between the agency's strategic directions and quality improvement, and to explore the key drivers for effective governance and leadership for quality improvement, including things like creating a culture of quality improvement, understanding data sources, and asking questions to understand quality. We also hope that will spark you to reflect on where you are in your quality journey at your own organization relative to leading governance and leadership practices that we'll talk about, and to consider some next steps, maybe those things you want to try by next Tuesday for your agency as you think about your own quality journey and your own quality plan. And I'll just add to that as well, we hopefully will also spark your interest in quality improvement and specific governance and leadership aspect, as we will be offering a very in-depth training session in the fall related to this piece. So you can stay tuned for that. And so we'd like to just do a quick poll here and ask folks, did you attend the governance and leadership training hosted by E-QIP in Toronto on April 26th? We know that some folks may have or may not have. That's okay, but we'd like to just get a sense of who may have been there. So you can just take a minute and complete the poll on your screen. Okay, so it looks like of those who are attending, 89% said they did not, and 11% said they did. So for 11%, thanks for coming back. But for those who didn't, this is good. This will be really an introduction for you to some of that content that we talked about at that session, and that we'll be covering in the session again in the fall, a really in-depth look at leadership and governance for quality improvement. So hopefully this will be a bit of a taste of what's to come. So by way of history, for those who may not be familiar with E-QIP and who we are and what we do, we are a partnership between Health Quality Ontario, who are both our funder and our partner, Addiction and Mental Health Ontario, and CMHA Ontario. And this really spawned out of a recognition that our sector, community mental health and addictions, does some pretty amazing work. But where we've typically been under-resourced is related to capacity to use data and to get data to drive continuous quality improvement. And so out of this recognition, we've developed a number of offerings to the sector that span until the end of March 2019, really to help support the sector and further cultivate that culture of quality improvement. And this includes things like quality improvement and data coaching. So you'll see in the triangle diagram there, we'll be doing 2 cohorts of project and general coaching. So one is happening right now, the other will be happening in the fall. We've also offering some network coaching to multi-agency networks, as well as various educational and training offerings such as Foundations to Quality Improvement training, change management training, as well as those governance and leadership trainings that I mentioned, among others. We also offer linkage and support to resources such as the Ideas Advanced Learning Program, which is offered through University of Toronto and Health Quality Ontario, and we can help support you in accessing that. And so when we're talking about quality improvement and what it is that we're doing and why we're doing it, E-QIP really looks at these 3 models and how they fit together. The one on the far right is, I think, why we're all in this business and what we're really hoping to achieve. That is the best care possible for clients and families who come to us. So hopefully that they're healthier, our communities and our population are healthier, and trying to do this at as low a cost as possible, because we know that resources are not ever flowing. And of course, supporting our dedicated providers in the work that they do. And in order to achieve that quadruple aim, we talk a lot about the domains of quality. These are the things that matter to our clients, matter to people who come to us, and really are that feeling for quality. If I come for service at an agency, good quality service is likely going to look like these things. It's likely going to be safe, timely, equitable, etc. And then that last model on the left is the model for improvement, and this is primarily where E-QIP operates, and that is taking a very structured approach to looking at those domains of quality, how it is that we are doing and where we might improve by asking 3 questions and then doing quick PDSA cycles to test our improvements. Similarly, Health Quality Ontario offers this bit of a roadmap or vision for quality in the system, and it's a pretty neat visual as it sums up pretty well what quality improvement is. And that is a health system with a culture of quality is one that embraces those domains that we talked about, that's safe, effective, patient-centered, etc. And stay true to principles such as committing to ongoing quality improvement, principles of achieving healthy populations, and ensuring accessibility for all. All of those things that are really the principles that help make quality happen. And of course, this can only happen when we engage with patients and the public, redesign the system to support quality care, help professionals and caregivers to thrive, ensure technology works for us all, support innovation and spread of knowledge, monitor performance with quality in mind, and build a quality-driven culture. So circling back to those domains of quality, which will really be a theme throughout this webinar, we'll take a look at what exactly those mean to us, but also to our clients and folks who come to us. So first is that domain of safety. We don't want our services to cause any harm to anybody. I think if folks are coming to us for help, the least that we can do is make sure that we don't harm them in the process. And from a client perspective, it's really just don't hurt me. Second is effectiveness. As providers, we want our services to be based on the best evidence possible to achieve the outcome that we're hoping to achieve. And our clients want us to support them. Third is timeliness. And from a service perspective, that's receiving service within an acceptable time frame given the need that's identified. And from a client perspective, that's don't make me wait. Next is client-centeredness. And from a service perspective, it's that a client can receive care within acceptable time after the need is identified. So once we know what it is that somebody's looking for or requiring, making sure that that we meet that need. And from a client perspective, that's be nice to me, provide me with positive experience. Next is efficient. So I deliver my service to my clients using available human, physical, and financial resources efficiently with no waste to the system. And from a client perspective, that's provide me with well-coordinated services without any duplication. And lastly is equitable, which pretty much crosses all of the domains, as well as being its own standalone domain. And that is that every individual receives high quality service that is fair and appropriate to them no matter where they live, no matter what they have or who they are. And ultimately that's treating folks fairly. So when we think about quality improvement as it relates to our roles, perhaps as leaders or folks on the board of an organization, it's important to look at it in relationship to our organization's strategic plan, because this is something that we're probably all very familiar with and is really the compass for driving our organization forward. And I would encourage you to think perhaps that rather than a quality improvement plan or quality improvement work being its own standalone piece, but it's actually the enabler for us to achieve our strategic priorities. Most of our strategic priorities laid out in our strategic plan actually fall within those domains of quality. And we can use our quality improvement plan to help set aspirational aims so that we can meet in a measurable way those items that are laid out in our strategic plan. So I'll follow it through with an example. We may have a strategic pillar saying something like, we want to make our services as accessible as possible within our community. Our quality improvement plan may help us to set a target within that domain of quality of timely access. We may say, for example, that we want to reduce the wait times for service. So we're looking in our quality improvement plan at the amount of time folks are waiting. We can then have a scorecard attached to that, something that articulates that in a very concrete way, in a measurable way that we're putting into action. So perhaps it's an aim with a % reduction in wait time that we're holding accountable for. And so it does, and it can actually fit quite nicely between a strategic plan and a quality improvement plan. And if your organization is large of size, you may have a separate quality scorecard attach those quality improvement plan items, or it may be integrated into your operational scorecard, having some outcome measures that you're measuring on a regular basis to see if you're actually achieving those aims. And we'll go into a lot more detail about this in a little bit. So when we're talking about a quality improvement plan, we're really talking about a commitment that the organization is making to its patient, staff, and its community, and to the province as a whole, to improve quality through focused, targeted actions. So saying that we're going to improve quality, but also giving a little bit of how we plan to do that, and how we plan to measure if we're doing that. It's a way to focus organizations and sectors and systems as a whole on key priorities, both local and provincial. And Health Quality Ontario, in their quality improvement process, help work with sectors to define what priority indicators might be. So if we're all looking at something that's common to us, maybe it's timely access or client experience, how we can look at measuring that in the same way. And that also helps us to harmonize the dialogue and encourage peer-to-peer sharing and benchmarking between agencies. If we're all looking at similar priority areas and measuring priority areas that we want to improve, we can start to have that conversation. And it also helps entrench quality improvement as a culture and a system-wide effort. Now, as leaders in organization, in our system, what do you think has more of an impact? This or this? Probably the I have a dream. So we want to think about when we're making a case for quality, how we may want to frame it with both our staff and our clients and our other local providers in order to inspire folks. We all have key performance indicators that maybe they're not as exciting as perhaps taking a client story or something that folks can relate to, and grab onto and inspire to help improve quality. I was up in the north recently, and we were in a community talking about transitions from hospital to community services, and something that we're all very familiar with, but can be rather uninspiring perhaps at sometimes when you're talking about stats and measurement. But there was actually a story in that community of a young person who left hospital and actually had committed suicide a couple of days later. And it spoke to why this issue was important, not just something that was on paper to look at, but actually a story that everybody could relate to and felt was important and really galvanized the need to make improvements. So sometimes going beyond just the stats and looking at the human side of quality improvement can have value. So how would you rate your understanding of the board's role in quality improvement? So we've asked you to take a moment to do a quick poll. All right, so looking at the early results, looks like 67% of folks said they're somewhat familiar, 19% are very familiar, and then the remainder are not familiar or are really unsure. Then you're in the right place. So, before I turn it over to my colleague, I'm going to walk quickly through this last slide, which will hopefully start to make it a little clear the role of the board and senior leadership in quality improvement, and really the dance that is the balance between governance and operations. So you see on the left the roles of a board, and on the right the roles of senior leaders. So on the left, you'll see that it's the role of the board to agree on issues and really priority areas for quality improvement in partnership with senior leaders. It's then the role of senior leaders to take those priority areas and articulate smart aims, measurable aims that reflect those priorities and how they can be operationalized. It's then the role of the board to again work with senior leaders to approve the articulation of those quality priorities and to approve the short and long-term goals with a focus on what's short-term, what the outcome measures are going to be, and how they're going to check and measure to make sure that those targets and outcomes are on track. And you'll see it's also the role of senior leaders to populate the short and long-term goals for the board for their approval and help identify those measures, gather baseline data, help set targets that are reasonable and aspirational that the board can monitor, as well as engage with staff in the development and action plans related to the process measures and putting those targets into action and monitoring the results that get reported back up to the board. It's also the role of the board to regularly monitor progress, ask key questions as it relates to those strategic directions, and really make sure that that those priority areas are being addressed on an ongoing basis, and that traction is being made to achieve those goals. And it's the role of senior leadership to assign management leads, regularly monitor progress, problem solve, and coach, and feed all that information back up to the board. This can be a helpful way just to kind of break it down. I know the arrows can be a bit confusing, but that dance that really is between the two roles. So with that, I'm going to turn it over to my E-QIP partner, Debbie Bang, who's going to take it from here.
Thanks, Mike. Hello, everyone. So I'm going to go through a little bit about the board and senior leaders and some of those roles. Talk a little bit about quality culture as well. So the slide that you're seeing right now is really about project orientation compared to having a core organizational goal and intention to use quality and quality improvement to be the best you can be for the client that you're working with. So on the left-hand side, it speaks about the project orientation, and there may be numerous projects that are going on in large and small organizations throughout the year. There might be some project leads that are involved in that. There may be some senior leadership involvement, but may not be. There may be some quality capacity, but it's not necessarily the focus, and teams have not necessarily been trained on what quality improvement is. Possibly a link between and some sort of reporting back to, through senior management to the boards. Finance may be involved. Senior leadership may spend some time at this. May or may not receive some results, which is always frustrating if you don't get those. And they're not necessarily sustainable if the targets aren't achieved, and they may not be something that you would spread. Whereas on the other side, when we think about quality improvement being a core organizational objective, what it is we want to do, there's investment both at the frontline team as well as all the way up to senior leader and board. There's significant involvement of leaders at all levels of the priority, whether it's simply asking questions about what the results are showing, posting those results and having a look at those. The key piece often is that staff and leaders are trained in quality improvement methods and also change leadership, because there is a process of change that happens with quality improvement. There is a very clear line between this is a strategic direction, and Mike spoke about that, a strategic direction for us, and this is what we're working on from a quality perspective. And the board has a stake in that, the frontline team have a stake in that, all people are interested, including finance. It really is looking at making a change for the client and the person that you serve. And those results usually are highly sustainable, and they're also something that you could spread or talk about or brag about with another organization. And that's the really key piece is sharing those learnings, and that's part of what E-QIP is all about. So this is the IHI, which is the framework for high impact behaviors. And I won't go through all of the different pieces here, but it really talks about relentless focus, that quality improvement is something that we live and breathe each day. None of us are perfect. None of our systems are perfect. There's some that we need to work on immediately. There's some that can wait for a bit, but we're constantly looking at ways we can do things better. It's person-centered, and it actually is looking through the client's experience and the client's eyes, family members, those that we work with, frontline team. The frontline are very engaged. They are the people who know whether this is working or not, and if it's not working, they're going to find some workarounds, or they're going to not be involved. Whereas if they're highly involved and they understand what it is they do and they feel capable and qualified and invited to be a part of that, some magical things can happen. It's transparent. There aren't a bunch of secrets that are going on around here, and it goes across boundaries, not only within your own organization, but those partnerships and those links that you have with others. And often the way that we make systems better is having that dialogue across, talking about what's not working so well and how we might make that better. So the role of the board is ultimately accountable for the quality of the service, and they need to make that ideally a priority. It's something that the board needs to be involved in. They also need information to be able to do that. So does your organization have a quality committee? Is there a focus on quality at your board meetings? And is there some literacy? Is there some words that people use and they understand? If someone says quality improvement, are we all talking about the same thing? Do people understand what that is and what it looks and feels like? They have a lead. The board has a lead on the vision and the strategy for your organization. And there may be some things that what Mike refers to as big dots and more quality aims, which may be multiple year, but they may be something that you're doing annually, and it may be something that's a little bit smaller. Where does it fit in the overall agenda? And is it aligned specifically with your strategic direction and budget? And ultimately, do we have some person power to be able to deliver that work? So same definition. The board needs to ensure that the risks to quality and safety are addressed, and this needs to be done in a very robust way. Do they even hear about what's happening from a complaints perspective, from an incident perspective, from concerns, from elopement, from things that are not going well? Is there a standard way that they receive this information? Are they aware of it? Is it clear? And is there a discussion that occurs when something happens that's untoward? And a way of thinking about how do we do that better? How do we prevent that from happening again? And what did we learn? And what information do we need to receive, including data that will help us to understand when this could potentially happen again? And then there's a model support for a learning culture. And this is really important, that not only is there a same definition of quality improvement, but that all understand that quality improvement is not so much about always getting it right. It's also about learning from the failures and things that don't go so well. And that's some of our very best learning most of the time. So they set a finite set of measures which the board should be involved in. And this is meaningful measures and meaningful data. And do they know where the data is coming from? Do you have a scorecard? Do you have a certain way that information is shared with and supported by and understood by all that are at the table? And there is a difference between what we are required to do to prove that we have people coming through our doors and that other piece of data that helps us to tweak and make our services even better. And it's understanding that what that data looks like, where the sources are for that, but all people at the table need to understand what that data actually says. And it's always very exciting to present some data to people and then have that discussion about, you know, what's actually on this, what information is here, what are the possible problems, what are the possible things that are going well, and what might we do about that, and to have those discussions at the table. And then you need to have some person power, and this is one of the things that is always a challenge in our sector is actual people that regularly do quality improvement, who are involved, understand the science, understand what it looks and feels like, are confident and comfortable with the data, presenting that appropriately up to senior management and to the board, also speaking with your frontline team as well, family members and clients. And that's actually their job. And that's the reality in many of our services, is that we don't have that person that exists for each of us. We don't have dollars allocated to do that, or we've stolen them from somewhere else. And it's trying to sustain that and make sure that that's a priority. If the board isn't on side with quality improvement, they're also not going to be on side with having some people power or some resources to be able to do this work ongoingly. So again, thinking about creating that quality improvement culture and what that might look like. And so just wanted to speak a little bit about the difference between quality assurance, which all of us continue to do. And that really is about compliance with minimal standards, whatever those standards are for you, making sure that we're accountable. For some of us, this is about accreditation, and that leadership's for telling. So this is what we do well, this is where we need to make some improvements, but we have a benchmark that we're aiming for, or a set of standards that we're comparing ourselves against. Whereas quality improvement really is about that ongoing, relentless, trying to understand, curiosity about what is working well here, what could be improved, and it aligns with our values, it aligns with our mission and vision and our strategic direction, but it also needs to be shaped by our clients. So what do our clients tell us is working really well here, and what is not working so well? And how can we make that different? And then the key piece here is really about that inclusive involvement from board to families, to clients, to frontline team, to senior leaders, to middle leaders, that there is a goal of influencing and helping people to learn and having those common definitions. It is about ongoing learning, better understanding, and talking with other agencies who are also doing this, who can help us to understand better what's going on. So a quality-first culture uses the experience of clients and what they value as the key drivers. What's important to the people that we serve. And most of us will be able to tell you that quick access to service and having a positive experience is what I would really like. Don't make me wait 6 months to get in to see you and then treat me badly. It aligns with a clarity of the focus around the organization so that all people understand what that is and are working towards that. Again, it's transparent. There's an openness. We talk about quality improvement as what are we not doing well. So we think about it from what are we not, what's our problem? What's that pain point? What are we not doing well? And many of us like to switch that to reframe it into a more positive, but what's that real problem? What is it we need to make a difference with? It talks about the team-based or the collective work and that ongoing accountability to one another. We are a system. It's not an individual's problem. It's an area that we need to continue to work on, and many minds make pretty cool ideas. And everybody can be involved in quality, and some of the work that we're doing with teams right now and some of the fun that we're having with change ideas and some pretty incredible thoughts that come up when we have multiple minds coming at it from a different angle. So a commitment to a culture of continuous improvement means that staff don't feel like they have to hide failures or errors, that they're able to talk about that and admit that, because it really is about a system problem as opposed to a person problem. They're recognized as an opportunity to learn and how we could do this differently. There's transparency about information. You can see the board posting here. This is what we're doing well. These are the complaints that we're receiving. This is what clients tell us that we could be doing differently. Is that front and center? When people walk into your space, are they able to see your strengths and areas that you're working on? And when you're working on something, what that progress is all about. And our frontline engaged and truly feel like they have a voice. So just to kind of summarize that, it really is about all levels of involvement with quality improvement. It's constant improvement as part of the core work that you do. The same as you deliver intensive case management, quality should be that same sort of commitment to the work you do every day. The reason why you come to work is not only to provide care to clients, but to make your work even better and even better for the client that you're serving. So board all the way through to families and clients. Significant involvement of leaders at all levels. All staff are trained. Board is focused on it. It's results driven. You've got data that's being looked at regularly, and there's an intention to spread or to brag about those new things you found, because someone else will benefit from learning. So a lovely quote here. The more we blame, the more providers stop talking. The quieter providers are, the less we learn. The less we learn, the less we improve. And the less we improve, the more at risk our clients are. So it is about being able to talk about what's not going well and thinking about how we might be able to do that better. So the next piece is on data and the importance of data in all of our quality improvement activity. We would love to do a second webinar where we talk some more about data. So this is sort of a broad overview for you. We're not going to test you on run charts or anything like that, but this is a run chart that's sitting on the table here, and a way of tracking information and helping to understand what's happening over time. And this one, of course, is tracked by the month. So there's a variety of ways that data gets communicated. For our clients and for our families, that board that talks about what we're doing, what improvements we've made, how we're tracking that is very important in your front lobby. For your board, your senior management, and your program managers, they may benefit from a scorecard, a series of run charts, a variety of different ways. So it's figuring out how that information needs to be communicated in your organization, standardize it. There's some lovely ways of doing that we're happy to share with, and make it real. Make it a part of your discussion at a board meeting, part of your discussion at a manager's level and your frontline team with your staff meetings. And then use the model of improvement to get there. So first off, what are we trying to accomplish? And that should be framed through the voice of your clients and your frontline team. What are the specific aims that we're trying to get to? How will we know that we got there? And that's about data. And that's about pulling the data when you need it and understanding what that data is actually saying. And if you're not sure what that data is saying, then call your provider, call your person that is helping to do that, whether it's OCAN, whether it's DATUS, whether it's OPOC, there's a provider there that can answer some of those questions about what the data actually says, what do they think it is. And the other is you've got peers that are doing similar work with you across the province. Call them up. Are they also doing OPOC or OCAN, or they're doing a game piece, and what does their data say, and can they help you interpret your own? And then what changes can we make that will result in improvement? And this is where we come up with change concepts and change ideas, and then we work through a PDSA cycle. These don't need to be long cycles. Quick action, figuring out what best to do. So when we speak about it at the next webinar, which we'll do in the fall, we'll really look at what data has to say, and possibly in June. Actually, we may do a piece on data in June to help people really understand where do we get the data, what do we understand about it, and where is it important along the model for improvement. So just a quick example of an aim, and this is one of our projects from this year right now, but they're looking at increasing the number of clients reporting their needs and goals as measured through the completed OCAN self-assessment from the current 40% to 80% by October 31st, 2018. So how much? SMART goal. By when? As measured by. So they all should fall under the domains of quality, which Mike went through at the start of the presentation. And again, lots of different ways of understanding all those pieces. And there's lots of ways of getting this information and getting to this aim statement in the first place. Okay, Ms. Jenna.
Okay, so I'm going to go over the last section of the webinar, and then we'll go through some E-QIP offerings that are coming up for the sector that you might be interested in. So as a board member, there are some key questions that you're likely going to want to start with to either continue your quality journey if as a board you've already decided that quality is a priority for your organization, or if you haven't gotten there yet, what are some questions that you can consider to help get you started and start that cascading effect of quality throughout the organization. So here are some key questions to consider at the board level. So how is the quality of our service or care? How do I know? How long do clients wait for services? What would clients and staff tell you are the first things to improve? What do clients' experience surveys / complaint data tell us about the client's experience with our service? And how are clients involved in improving quality in our service? So if you reflect on these questions, as a board member or senior leader, think about how well you can answer these questions and what are some data sources that might be able to tell you how well or where some opportunities for improvement might be. And how often are you seeing the results of these questions throughout your organization, and how often is the board actually reviewing this, or how can they answer these questions as an organization? And this slide is just a little bit more detail in terms of what you can consider at the board level on some key areas to start you off or continue to grow your quality agenda. So again, these are just more detailed than the last. There's some questions regarding data, and if you are getting some quality related indicators reported up to the board, how are you doing that, and what are some benchmarks or areas where you can learn how to improve your priority quality agenda indicators. I'll highlight two questions here. So the second question on this wheel, what are the priority areas for your organization? So I think, related to the strategic plan, I think most organizations would probably be able to answer that question, but how it relates to quality and what indicators are being rolled up to the board level to let you know how those priorities are going and if they're improving is essential. And the second question I'll highlight is question 7. So has your quality plan been developed with input from clients and families or client advisors? And this goes to the overall theme that we're hoping that you're gathering from the webinar, that quality is really about client care and families that you're serving, and how well do you know what they want and what their needs are, and if you're actually improving to meet those needs. So right now we're going to go over some E-QIP resources and what's coming up for the project, some of which I think you might be interested in. If you do have any questions on what you've just heard, I encourage you to write them in the question box, and then we can get to those after this section is over. So we'll just do a quick poll. On if you're planning on sharing what you've learned today with others in your organization. And I'm seeing that mostly everybody's saying yes, and there's some unsures. And there's no no's, which is good. So that's great. So we'll be sending you the slide deck from today, as well as some other resources via email tomorrow morning. And feel free to share those with others on your board or in your organization to help you share the messages that we've gone over with you today. We'll also be posting everything on E-QIP's online community of practice, which is our online platform where all of our tools, templates, and training materials are posted. We also have discussions that happen there on quality improvement as it relates to the community mental health and addiction sector. So we encourage you to join up for that. There's a section that will flag for you in the follow-up email that's specific to senior leaders and boards, and we'll direct you to where those resources can be found so that you can continue to learn more about it. And this is a slide on our webinar series. So we've done 10 webinars to date, 11 after today, on learning about quality improvement as a sector, and all of these are very sector specific for Ontario's mental health and addiction sector. Our upcoming newsletter in June will have some highlights from work that we've done over the last couple of months, but also some upcoming training opportunities and webinars. So keep an eye out for that. If you're not part of our newsletter, I encourage you to sign up. And again, that information will be in the follow-up email from today's session. And there's also some Health Quality Ontario webinars that are coming up that are noted there. And if you're part of HQO's newsletters, you'll get a notification of when these registrations are open, as well as we'll post them through the E-QIP newsletter. The Advanced Learning Program from Ideas is open for a 17th cohort of projects that this group supports. The E-QIP team is available to help you if your organization is looking to apply to this program. It's a coaching-based program if you're not familiar, and there's a link on this slide to learn more about the program. The next cohort isn't due until September 15th, but we're here over the summer to help community organizations apply to that program, and they are saving 5 spots for us in that session for folks from our sector. And E-QIP projects, we're opening our 3rd cohort of projects has been opened, and the applications are due July 15th. So if you're interested in working with us closer and working through a quality improvement project from beginning to end, or if there's some other general quality improvement needs that you might have, we encourage you to apply or to reach out to Mike or Debbie to help you in understanding how you can benefit from the services that our coaches offer. And these are just some actions for you to consider following the webinar. So some quick things that you can do to help share what you've learned today. So the first one is to share the slide deck and materials and recording with others in your organization to help, again, share those messages that you've learned and start having conversations of what you might want to do moving forward. Book a time at your next board meeting to talk about it. So once you share the materials, book a time on your board agenda to talk about what your next steps might be to move your quality agenda to the next level. Sign up for our newsletter, which I've mentioned before, and connections to that will be in the follow-up email tomorrow. In the fall, we are hoping to have another session on governance and leadership for quality improvement and in-person all-day events. So today was really just a primer of what we offer on that day, and our first session was a lot more in-depth in terms of all of the themes and topics that we've covered over the webinar today. So if you sign up for our newsletter, you'll be able to see when that date is as soon as we know about it. And to join our community of practice and get access to additional resources that will help you in your role as a board member or senior leader. And this is the E-QIP team. So if you have any questions at all or need support, we're all here to help. And Mike and Deb are here as well with their phone numbers, and emails are always available to help organizations across the province learn about and apply quality improvement methods. And we just encourage you to take the survey on our webinar today to let us know how we did. There's also some important questions in there in terms of if you are interested in attending the full day event on this topic. We're asking you to identify where a convenient location would be so that we can help, we can plan accordingly in terms of where the needs and requests are for this training. As well as any ideas that you have on additional resources or training needs that you have as a senior leader or board member to help you in your quality improvement work. So I encourage you to take that survey so that we can learn how we can help you better. So I don't know if there's any questions.
Not yet. Okay. Oh, they're stuck on the poll page. Sorry about that. No, they just all outside. Okay, so we'll give a couple minutes. If there's questions on the actual content of the webinar, apologies for not advancing the slides forward. I didn't realize that was happening. You'll get those tomorrow.
Yeah, the slide decks you can actually download from the GoToWebinar, and you'll also get them via email tomorrow. Okay, if there's no questions, then we can close the webinar and just reach out to us if you have any questions or concerns of what we went over today.
Thanks everyone for attending.
Thank you.